any other week without this story, the health minister, Sylvia Jones, would have had unusually good media coverage, because she came out and said that, they're really making some progress in terms of getting primary health care delivered to Ontarians, Tim. The numbers were huge, and they were unacceptable in terms of folks who didn't have family doctors or GPs, but they've come out and said they've pretty much cut that in half already based on numbers from last January.
That's a great point. And that's one of those things that you would, keep a progress report as you match up more people with a family doctor. I should say off the top, Dave, Ontario Medical Association is one of my clients in the consulting world. So I'll let folks know that. One thing I've always believed in, when I was PC leader was, when you take a team-based approach, right? When you can have doctors working with nurse practitioners, working with, chiropractors, working with nutritionists, it's much better comprehensive care. And if you can free up the doc, then from the paperwork, I think physician-led, right? Then you can actually spend more time with patients and then get more patients matched with doctors. So good for Minister Jones. I know something she's always cared deeply about when we were in opposition together. I would just keep pounding away that good news and look for more ways of this team-based approach, relieve the paper burden on our healthcare professionals, and keep fighting for progress.
Same story, though, John, is that the province has stepped in and said, those who graduate from Ontario medical schools will get priority in terms of, residence jobs in the province. I can see both sides of that. I understand the benefit of having a young medical student who grew up and went to high school in Ontario, going to university in Ontario, and getting a job in Ontario is more likely to stay in Ontario.
Well, if I understand the policy correctly, it's also to liberate those who have gone outside of the country because they can't get residency here, or they want to fast track it to become medical doctors and they've gone to other countries. I mean, Ireland, I think, is producing more Ontario ex high school kids as doctors than any other place that I know of. I'd answer it a couple of ways. Number one, again, I talk about retail politics from this government because that seems to be how it's dealt with. And so this plays to that notion. I mean, every poll that you would have on this would say that Ontarians and Canadians in general would say, look, if a kid's from a province and they graduate near the top of their class, they shouldn't be forced to go elsewhere and get a medical degree and then come back to Canada and hope that they get in. This encapsulates the, made in Canada, let's keep our own here, and to, reject always bringing in foreign students or those who have come from other countries to do that. I'm not exactly sure how that's going to affect the medical profession, but in this neighborhood alone where I live, there's at least 3 young people that I can count who have gone to other countries, 1 to England and 2 to Ireland, 1 to London and 2 to Ireland, who couldn't get in here and who are fast-tracked to become doctors and are coming back. So, I mean, that's kind of one part of this. I wonder where Jane Philpott is in all of this. I mean, it's one thing to have the minister who's talking about this and getting credit perhaps for it. And she tends to be, on point and does the press conferences, but we know that she doesn't say very much very often. But we also have somebody who's in charge of this file, from trying to link up people. And I wonder whether or not it's time that we get another voice on this, a former physician, or I guess you never become not a physician in a sense, but somebody who's leading this and maybe part of that discussion. I think it's going to play okay. I hope that, with the Canadian Medical Association and the OMA saying that it could disrupt where we are and all of this, that it's not going to be the case. But I think I'm interested to see where Jane Philpott is in any file on this, because I haven't heard from her since her appointment. So it would be interesting to get a perspective from her.